My name is Aseel and today I'll be presenting Artificial Intelligence in Pharmacy. What is artificial intelligence? Healthcare today is generating large amounts of data, often dispersed between separate systems. This is a challenge for physicians to collect and understand the data. AI is a scientific discipline that assists physicians in collecting and understanding that medical data. History of robotic surgery. Decision-making that's based on clinical impression alone would often be slightly uncertain. Therefore, AI techniques have recently emerged and revolutionized healthcare impressions by providing invaluable data and predictions to assist physicians rather than replace them, as some critics debate. There are three main types of robotic systems currently in use in the surgical arena: active, semi-active, and master-slave systems. These systems are self-explanatory. Active systems are fully autonomous. Semi-active systems allow cooperation of surgeon-driven elements and robotics, and the master-slave systems lacks any pre-programming of robots and puts them under the surgeon's command as if they were like any other surgical tool. This is an example of artificial intelligence in endoscopy. Picture A is a conventional endoscopic image of ascending colon, while picture B is an endocytoscopic image that was diagnosed as healing by computer-aided diagnosis. If I click on the picture now, we can view a video of artificial intelligence in endoscopy. Artificial intelligence and big data in public health. The public health sector is heavily invested in developing ethical standards for the application of AI in medicine. The set guidelines include: algorithms must be free of bias in coding and self-explanatory if possible, and pace of automation must be controlled to ensure incremental adaptation when necessary. Also, the public health sector stresses rights to ownership of genetic information to avoid influencing consumer risk perception. Real-world application of artificial intelligence. Diabetic retinopathy, also known as DR, is a diabetes complication that affects eyes. It's caused by damage to the blood vessels of the light-sensitive tissue at the back of the eye, the retina. The application of artificial intelligence in ophthalmology mainly concentrates on the diseases with a high incidence, such as diabetic retinopathy, age-related macular degeneration, glaucoma, and so many other things. To detect TR at an early stage, initial screening can be accomplished with dilated fundus examination or retinal photography. Will artificial intelligence serve us or replace us? AI machines lack empathy and cannot solve problems based on experimental learning. They merely use existing algorithms to direct clinical practice, which usually have little impact on actual medical practice. Therefore, while it's likely that AI machines will surpass humans in informational intelligence in the foreseeable future, it remains highly unlikely that AI will replace physicians anytime soon. Thank you for your time. My partner Dayan will further elaborate on our topic.
In this slide, we're going to be talking about artificial intelligence in COVID-19 drug repurposing. Moreover, drug repurposing is also termed as drug repositioning, retasking, or reprofiling, and that is because it's a strategy that uses medicine that have been already clinically tested. In this image, we can see that artificial intelligence approaches a greatly accelerating drug repurposing by incorporating biological knowledge, such as human intercom organelles, tissues, and organs. The 5 essential elements required to understand the repurposing of a package include the PHEWA analysis, protein function review, drug, precise indication, validation experiments, and lastly, clinical trials. This video is a demonstration of how drug repurposing is performed. Moreover, artificial intelligence can also be used in cancer imaging. Artificial intelligence finds great utility in performing 3 main clinical tasks, and these are detection, characterization, and monitoring. In current clinical practice, tumors are typically manually defined with associated limitations including interrelated bias, inconsistent reproducibility even among experts, and consumption of time and labor. In picture A, we can see annotation samples of the positive circumferential resection margin. The left side shows the results marked by the computer, and the right side shows the results marked by a radiology expert. However, in picture B, we can see how a patient is being prepared for radiotherapy. Head and neck immobilization is essential in this step in order to get accurate results. Mental health clinical data is often in the form of subjective and qualitative patient statements and written notes. However, mental health practitioners have still much to do with and to benefit from artificial intelligence. The most common styles of learning used for healthcare purposes includes supervised machine learning or SML, unsupervised machine learning or UML, or deep learning DL. This picture elaborates on the fatigue detection model that first extracts 6 types of feature sets from eye tracking data collected while participants watch video. The retina expert needs to be aware of the large spectrum of machine and deep learning methods, which will be the basis of clinical management decisions. This picture demonstrates recent advances in the segmentation of CFP and OCT that show comparable performances between human graders and machine learning algorithms.